Hi, everyone. I'm Andrea Warnick. I'm a nurse and registered psychotherapist.
I'm Kaylee Eaton Russell. I'm a child life specialist and children's grief therapist.
And Kaylee and I have worked together for what, 20,
20 years.
20 years, 20 years now. And we're conscious that globally June is recognized as Alzheimer and Brain Awareness Month. And so we spend a lot of time in our career talking about different ways of explaining things to kids and helping them understand. But we thought this was a really important time for the two of us to come together and have a conversation about this topic because it's something that's been very relevant for us in our personal lives as well. My mom has Alzheimer's or possibly mixed dementia. We don't actually know for sure, but definitely some type of dementia.
And my dad had Alzheimer's, and my stepdad's navigating dementia as well.
And so we just wanted to come together and share some of the conversations that we've been having together personally about how we support our own families, how we're navigating this ourselves, but also it's something I'm talking about more in our therapy practice as well, recognizing that there's a lot of complexity that I don't think either of us really appreciated doing this work professionally until we were actually in the trenches of living it as well. And so I'm wondering for you, Kil, if you want to share any of sort of the insights that you've had in your experience that might be useful for other people.
I think as a clinician, I think one of the things that seems really clear is like this is such an example of an ambiguous loss where there are, the person is still present, but psychologically their presence is really changing. And as a human, like not seeing it in a theoretical lens, I think one of the biggest pieces that I struggled with making sense of my dad's experience was when, on one hand, he's still my dad, no matter how much he's changing. I love him so deeply and no matter what. And I still want to treat him with the respect and love and honor that like he's still him. I still want to relate to him that way, even though there have been changes. But at the same time, the way that he's relating to me and the world is changing so much. And sometimes there were things that I felt like, oh, I can't take this personally. It's not really him. And that tension between it's him, it's still really him. So I need to treat him this way, but it's not really him. So I can't take it this way. That's incredibly challenging, I think, to be with and try to navigate. That was one of the biggest ones for me.
Yeah, and that's definitely been part of my experience too. I'm often retroactively thinking about how I've responded to my mom's anger or frustration with me. And I'm having that very conversation internally, but I've already sort of, flipped my lid or had a really hard time. And so it's a continuous learning and trying to remind myself of that in the moment. I think for me, one of the pieces that I really think I underestimated before living this experience is how much like any unprocessed grief and trauma comes to the surface as somebody's navigating dementia. And I know I always would hear, I've got friends who work in the Veterans Center at Sunnybrook and things like that. And people talking about like, yeah, people who, survived World War II and everything and never talked about their experiences in combat. And then as they're dying, often having these conversations. But that's been very much a part of our experience where, a lot of what was unprocessed for my mom really coming to the surface. I also know, there's a lot of families and communities. I mean, I know a lot of the traumas with my mom. So in some ways, like it's not catching me off guard that she's re-experiencing these things, but certainly the fact that it's so present and so overwhelming. Like I wasn't expecting that we were all going to be navigating that, but I know there's many communities where people don't even know the trauma situations that their person has gone through until they've got dementia or Alzheimer's and it's getting thrown out and all over the place. And these stories are coming up and how difficult that is for families to navigate.
And you've never had an experience of having conversations about that kind of thing before to try to figure it out in this context.
Yeah, and it certainly sort of inspired me to be even more committed to making sure that as much as possible, people have accessible support and access to grief support and trauma support. And often I say one of the hardest things about being grief therapist is convincing people the utility of doing grief and processing the hardest stuff that they've experienced. And this for me is really sort of reinforced that.
Yeah. Yeah. I think one of the other big pieces we were thinking about is the way that our children perceive and navigate and understand. And I was thinking about when my dad was experiencing Alzheimer's and significant decline at that time. My daughter was 2.5, and I remember driving. And my whole job is about being open and talking with kids and using the names of illness and all of that. But as a parent of a 2.5-year-old, I hadn't done that. And we were driving to her daycare, and I realized driving, and she's in the back seat, that I had forgotten my keys and said, "Oh crap, I forgot my office keys." And she started to cry. And I asked, what's the matter? It's okay that I forgot my keys. And she said, "You forgot, and Grandpa's forgetting. Are you forgetting like Grandpa? Are you going to be like Grandpa?" And I thought, oh, no, this is different. And so just like we always say, to use the name of the disease, even if, it doesn't matter how old they are. I had not been doing that. And so I did explain, like, Alzheimer's is affecting Grandpa's brain, and it's making it so that he loses more and more memories over time. He's forgetting things because of Alzheimer's. I'm just forgetting things because I'm an underslept parent. I'm too busy. There's too much going on. But I'm not forgetting things for the same reason. It's not going to be the same as for him. And then checking in with her again later. I have no sense of time. Might have been the next day, might have been the next month. But just checking in with her, realizing that I should, because even though she's witnessing all the same things as I am, it's still important to check in with her and make sure that she knows that it's okay to talk about. And so I asked her, what was she noticing or thinking or feeling? And even as a less than 3-year-old, she said, "It's like he's losing himself." And it was that was really hard to hear because it was so accurate. And I'm so glad that I checked in and that she knew that she could talk about it. And I didn't have anything reassuring to say back. There's no like answer. It's just, yeah, you're right.
Yeah.
It is like that. And it's awful.
Yeah. Which really to me highlights like the capacity of young children. Like I find they're often the quickest to get sort of pushed to the sidelines and excluded from conversations. And I think that's such a powerful story, really demonstrating their ability to be part of the conversation and everything else. And, I think the checking in piece is so important. And I've even caught myself because, it's so insidious when you have a dementia diagnosis often, and it can be over a long period of time. And I've missed it myself with my own children, and my children are much older than that, but even my teenager, in terms of just being like checking in now and then about like, how is this for you? Like, do you have questions like or worries that we could talk about? Because there's a lot of grief under the surface that even I've missed, because it has sort of been so slow. And that's where I'm really trying to do a better job of checking in with myself, but, also my family, and my mom is something that I'm really conscious too, of just checking in with her, and don't do nearly as good a job of it as I'd like. But I asked my 10-year-old, it was like, if you had advice for like adults about how to support kids when somebody does have a dementia diagnosis, like what would you say? And she was very, very clear. She was like, you need to be really honest, even about the hard stuff. And so like you want to let kids know that like at some point the person is going to get to the point where they're, not going to remember your name, and probably not even know who you are at some point as well. And so she felt that was really important for kids to know. And so she was like, be honest about it, but don't be overly dramatic, mom, was her advice. So,
I think it's so tricky too, because like in the vast majority of cases, I think we can anticipate that it's at some point likely to get to that place, but that there are those rare instances where, a person forgets a lot of other things, but still recognizes, or still, I know with my dad, he didn't, I know he couldn't place who I was for ages, months and months. And then once in a while, there would be a glimmer of like, I think he might recognize me in this moment. But it's so, and then the roller coaster of grief is I think one of the awful things you said, it's insidious and it's so long lasting. And so such a slow deterioration is, I think we can spend such an incredibly long time in this space of like, oh my God, how much longer can this go? How much worse can it get? It's been so awful for so long. And that's like grief burnout is, that's really hard.
Yeah, I think it's a really good point. And as you said earlier too, it's often, it's overly academic term, but disenfranchised grief, where it's like big grief, but often not necessarily recognized by everyone else because the person is still alive. I think there's, you've got a really good way of describing sort of like if we're talking to kids, what dementia is like. I've tried to use the analogy. I totally butcher it. I'd love you to share it with everybody else.
I feel like I'm still working on it, but I love an analogy. So I've been trying to think of it like each of us is a library. Our brain is like a library. Like imagine if inside all of our minds are so complex. Our brains control everything in our body, all of our thoughts, our feelings, our actions, our memories, how we do stuff. So what if we imagine that our mind is a library and there's like the self-help section, the how-to manuals, how to brush your teeth, how to tie your shoelaces, how to cook. There's like a genealogy section, all the people in our families, like scrapbooks, all kinds of stuff. There's an encyclopedia with all the facts, all the things we absorb. My son's like dinosaur section or Minecraft section or whatever, that everybody has so much knowledge, but also the stuff you know how to do, the people who are familiar to you, all of that. And portraits on the wall of all the people who are important with little plaques with their names. And I imagine over time with different kinds of dementias, there are different ways that these libraries get disrupted. And whether it's like the plaques that are growing and, brain plaques, like covering up parts of the plaques that say a person's name, or like in some kinds of dementia, it's like the books got all pulled out and they're just not put back right, or the spines got rubbed off so you can't see what's what. And so the stuff is still in there. And I think especially like your familiarity with the people who you love, like the connection is still in there. The love is still in there if it's that kind of a relationship, but accessing, being able to put your finger on the right book, being able to find the right, like, can't find the how to tie my shoes today instructions, can't find the map of how do I get to the bathroom, or how do I get to the grocery store, like the books get misplaced, or sometimes maybe there's like, seems like, when you think of a kid's room and you're like, oh my gosh, it's like a tornado in here. I think sometimes it's like that. the stuff is all in there. The person is still themselves with all those stories and experiences and moments in there. It's just so impossible to find the right thing in the right time. And I think that also, to me, is like, it's got to be so frustrating on the inside of that library. And so it makes sense to me sometimes how like behaviors and emotions get significantly altered, but also that like that might be some of the books that are misplaced, is like, how do I let out this feeling in a way that's not harming me or somebody else? And all those traumas that you talked about, that might be books that have been buried for ages and ages, and somehow they're the ones that are stuck open. And just as a way of understanding, like, it's not the person, they're not choosing any of this, but the library is kind of in turmoil.
Yeah, I think that's such a good way to describe it. It sounded much better coming out of your mouth than it did when I tried to do that. So is there anything else, Kiel, that you wanted to share with people about this experience? I know it's something we're going to be talking about a lot more at AWC, including some of our upcoming education events. So like, please keep an eye on our website, awcgrief.com, for that information.
I think the one other thing that I was thinking about when you were talking about disenfranchised grief, and how like this is really hard. It's really hard to have some of those feelings about like, how long can this go, or feeling hurt when the person is treating you in a way that is hurtful, or feeling hurt that they're not recognizing you. And there are so many hard feelings, but also that some of the stuff that comes with it, some of those hard feelings, it's really hard to know who you can talk to about that stuff. And to feel okay. Like, I think there are so many aspects of grief that we feel guilty saying out loud. I don't know how much longer I can do this. I don't know how much longer I can be patient. Or like, I think one of the things that I just really want is for people to be gentle with themselves, and to know that this isn't hard because you're doing it wrong, right? It's hard because it's just really, 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 really hard.
Yeah, I think that summarizes it. Thank you, Kiel.
Thank you.
Take good care of yourselves, everybody.
Thanks.